back to Cellmate, where A-level biology is made easy. My name is Ruana Lanzi, and we will be discussing HIV/AIDS. Now we have seen that the HIV virus is in the bloodstream. It's replicating and multiplying and destroying all white blood cells. So how fast does this happen, and how fast does HIV spread in the bloodstream? CD4 is a specific glycoprotein. CD4 produces hundreds and hundreds, possibly thousands of copies of HIV particles. Again, it is a glycoprotein. It's found on the surface of immune cells, specifically in our case, T-helper cells. So as shown in the diagram below, here is our CD4 protein, and here is our surface of the immune cell. So it's attached to the surface of the immune cell, as shown in the zoom diagram here. So the CD4 protein produces hundreds and thousands of HIV particles to spread throughout the bloodstream. While HIV is replicating and spreading throughout the bloodstream, the patient may experience active HIV syndrome symptoms, such as headaches, fever, a high temperature, and fatigue. What is the latency period of HIV/AIDS? Before we jump into that, let's first define the latency period. It is the time between the pathogen entering the host and the host becoming infectious. In terms of HIV, it is the time between the HIV virus entering the human body and the human body becoming infectious from the HIV virus. A patient could be asymptomatic. This means they have no symptoms. It could take up to 8 to 10 years for symptoms to appear. However, this is more likely if the patient is not on medication. The immune system is extremely weakened. Now, this is due to the fact that HIV has destroyed most of the white blood cells, and there's a significantly low amount of helper T cells. The common symptoms of AIDS. These include severe and unexplained weight loss, fever, diarrhea, and dementia. Now, an important point to notice is that if you have both HIV and opportunistic disease, this means that you have AIDS for sure. We mentioned that an opportunistic disease is a disease that takes advantage of the human's weak immune system. Opportunistic diseases include meningitis, pneumonia, and tuberculosis. Now, there are some common tests for us to take to know if we have HIV/AIDS. These include a blood test, a urine test. Now, a urine test will determine whether the patient has antibodies or not, and by saying if the patient has antibodies, we will know whether this person has the disease or not. And finally, a saliva test. There are many ways in which HIV/AIDS can transfer from person to person. Some of the mode of transmissions include semen coming from the male, vaginal discharge coming from the female, breast milk when a mother feeds her child, or by the placenta when a mother is giving birth, non-screened blood, and used syringes, needles, and razors from the infected person. To prevent HIV/AIDS, one can simply contact trace and screen the blood, and always dispose of used syringes, needles, and razors. An HIV test, which we mentioned examples such as the blood, urine, and saliva test, could take up to 20 to 90 days, and of course, practicing safe sex. As for the treatment of HIV/AIDS, unfortunately, there is no current treatment for this disease. Once the body is infected, there is no going back. However, HIV can be controlled to prevent further complications. Antiretroviral therapy, known as ART, is basically HIV medicine. So there is no current medication for this disease. However, antiretroviral could prevent HIV from further spreading and control it. Now to finish our video with a short summary. HIV leads to AIDS, which is life-threatening. If you have HIV and an opportunistic disease, you have AIDS. This disease weakens the immune system by decreasing the amount of white blood cells, specifically the T-helper cells. Semen, breast milk, non-screened blood, used syringes are examples of how HIV/AIDS is transmitted. To prevent the disease, practice safe sex, get a HIV test, and dispose used syringes and needles. There is no treatment for HIV/AIDS. However, HIV can be controlled by a medicine called antiretroviral therapy. Thank you for watching. We appreciate your support. Don't forget to like and share, and feel free to ask us any questions.